Madat, bienvenue, and welcome to a special Friday Night Reflections COVID update. My name is Iman Rajwani, coming to you from Vancouver, and I am honored and pleased to be your host this evening. I want to wish all of you and your families a very happy new year. I hope that you were able to enjoy some of the holiday season despite the challenging circumstances. With all the information that we see on the media every day, some of us still have questions regarding COVID and Omicron or are unsure about some of the things that we've been hearing. For so many of us, this wave of COVID has been more personal than ever. Either ourselves or our family members, our loved ones, friends, colleagues have been dealing with COVID, sometimes even with repeated infections. Towards the end of 2021, I was even dealing with a COVID infection myself, and I can tell you that it was a very difficult experience, not only related to the physical symptoms, but also coping with the mental and emotional stress that came with isolation and being unable to work or attend Jamaat Khana. Thankfully, I'm fully recovered now, and I feel much better. Something else, though, that I would like to stress is the importance of reducing stigma during the pandemic when it comes to contracting COVID. With the virus becoming increasingly transmissible, I think that it is imperative to continue having open and sometimes even vulnerable or uncomfortable conversations that address common misconceptions and concerns. So with that, I thank you so much for joining us this evening. Tonight, we're pleased to be joined by a distinguished panel who will be answering a number of questions that are on the minds of many. Dr. Tasleem Nimjee is an emergency physician in Toronto and an assistant professor at Queen's University. She is the Chief Medical Innovation Officer at Humber River Hospital and has played a pivotal leadership role as a physician lead for the COVID-19 emergency response. Dr. Shazeen Suleman is a pediatrician at St. Michael's Hospital, Unity Health Toronto, and an assistant professor at the Temerity Faculty of Medicine at the University of Toronto. Her clinical and research interests focus on improving access to care for children new to Canada with special healthcare needs, including medical complexity and developmental disabilities. Dr. Karim Kurji recently retired as Medical Officer of Health for York Region in Ontario. Trained in medicine at University College Hospital, London, he first trained in family practice before going on to London School of Hygiene and Tropical Medicine, and then specializing in public health in the UK and Canada. Thank you for joining us for the Q&A portion of today's episode. Dr. Kurji, we're going to have you start off with our first question.
याले मदद मेरा नाम अमीना अहमद है और मैं टोरंटो से हूँ। मैंने सुना है कि ओमिक्रॉन कम खतरनाक है, लेकिन मैं ऐसे लोगों को जानती हूँ जो ओमिक्रॉन की वजह से बहुत ज़्यादा बीमार हुए हैं। तो मेरा सवाल ये है कि क्या ओमिक्रॉन दूसरे वेरिएंट से कम खतरनाक है या ज़्यादा? शुक्रिया।
Thank you. So the Omicron variant has had many mutations of the spike protein. This has made it much more infectious, and it has also been able to evade immunities for the person, whether this has been acquired through past COVID-19 infections or whether it has been acquired through past vaccinations. The incubation period of the Omicron virus is also shorter. This means that a person is infectious in a shorter period of time. We also know that the Omicron variant can often cause asymptomatic infections, perhaps much more so than the other variants. So all this combined has made the Omicron variant some 3.5 times more infectious than the Delta variant. And this has given rise to an exponential growth in the numbers of cases that you have seen in many countries around the world. With a doubling time of cases of between 2 and 3 days, this has posed enormous challenges. Whilst the Omicron variant is less virulent than the previous variants, the fact that it is so infectious and so transmissible means large numbers of individuals have become cases. And this has resulted in a growth in the numbers of hospitalizations and ICU admissions. We are also challenged by the human resource implications of this particular variant, with a lot of staffing shortages occurring within the hospitals and healthcare in general, and of course across many other services. So altogether, it's a formidable challenge.
Thank you for providing your insight on that. Dr. Nimjee, what can you tell us about the difference in symptoms between Omicron, Delta, and previous variants?
So I think it's important to remember that when we talk about different variants, that usually means that there is a mutation in that virus that makes it look a little different, act a little different. And usually that is there to sort of change the way that virus can then infect the body. So in this case, we know that Omicron is spread more easily. It's far more infectious, as we call it, but it doesn't actually mean that the symptoms are necessarily all that different. So when we think about COVID-19, right from at the very beginning of the pandemic, we were characterizing symptoms as very similar to flu-like symptoms, except the severity was the biggest thing that was different. And what I would say here is you still need to think about flu-like symptoms, even when you think of Omicron. So you're still thinking about, runny nose, sore throat, cough, headaches, sore muscles, feeling tired. What's unique about COVID, obviously, and what we've seen, especially with the Delta variant or other variants, is how sick people became. Omicron is different in that it's more infectious, but in order to be more infectious, often the virus has to actually be a bit milder and that people may not get as sick. So they're out there spreading more to other people without even realizing it. And that's what, when Dr. Kurji was talking about asymptomatic infection, for example, we know you see that more with Omicron. So I would say bottom line is if you are infected with Omicron, you may feel nothing. You may feel what feels like a small sort of minor cold, or you may feel like you've been hit really hard with a bad flu. And that's all the same as it would have been with previous mutations.
Thanks, Dr. Nimjee. Now another question for Dr. Kurji. How effective are vaccines in protecting against Omicron?
So the first principle is that we must remember that vaccines were designed not necessarily always to stop infections, but they were designed to prevent serious illness, hospitalizations, ICU admissions, and death. In that respect, when it comes to having had 2 doses of the mRNA vaccines, they're not particularly good at preventing the infections, but they are very good at preventing hospitalizations. According to studies in the UK, these numbers are around 72% with respect to preventing hospitalizations. However, given that immunity tends to wane with time, giving the booster dose certainly increases that tremendously. So, not only are people able to avoid getting infected and getting symptoms, and the proportion there varies from 37% to 66%, but the hospitalization protection is enhanced greatly to around 88%. So this makes it very important for everyone who is eligible to get a booster dose.
Thank you for clarifying that, Dr. Kurji. I have another question for you as well. I know that a lot of people, when coming for their booster shot, are being offered Moderna and turning it down, saying that they will wait for Pfizer instead. Is this backed by evidence, and what are your overall thoughts?
So in general, the Pfizer vaccine is one that is recommended for people under the age of 30, given some associations with an increased risk of myocarditis in the younger population with other vaccines. That having been said, the Moderna vaccine is very effective, as it is actually an mRNA vaccine and is very similar to Pfizer in the mode within which it functions. In fact, according to some studies, The Moderna vaccine may be even more effective than Pfizer, and its effect may actually last longer. So a cardinal principle here is that the Omicron virus is spreading so rapidly that it really would not be advisable for anyone to wait for the Pfizer vaccine. Please get the very first vaccine that is offered to you. That has been a principle that has worked well for us in the past and continues to do so now.
Dr. Suleman, with this Omicron variant, should we be thinking any differently about protecting our children?
Thank you so much for that question, Iman. I think it's important that we remember that COVID does affect children. Every day now, we're hearing about yet another child who has died from COVID-19. We know that children can get severely ill from COVID-19, including with the Omicron variant, which with a particular type of inflammatory response called MIS-C. And we also know that children are affected by long COVID. And so it's important that during this wave, we do everything we can to protect our children. We're lucky in that we now have a vaccine for children ages 5 to 11. And yet, unfortunately, across the country, we only have 40% of children in this age range who are vaccinated. So what I would encourage every parent to do is to get their child vaccinated as soon as they are eligible for their COVID-19 vaccine. And if they have any questions, call your doctor, call your child's pediatrician or family doctor, and have a conversation with them so that you can make a decision that best protects your child and your family.
Thank you, Dr. Suleman. I have another question that's sort of related. This is a common one from parents, and it actually comes to us from Edmonton.
For parents with children under 5, the situation can be very difficult. It is our understanding that both Pfizer and Moderna have both delayed their trials in young children. Do you have an idea of when vaccines may be approved for children under 5?
I smile because I really wish I had a crystal ball that could know when everything was going to be approved. I know that Pfizer and Moderna are currently testing their vaccines for children 6 months to 5 years. And in December, Pfizer announced that although they had seen a good response in their 2-dose series for children under 2, they were hoping to see a better response in the ages of 2 to 5. So they have actually changed their 2-dose regimen to a 3-dose regimen. I am hopeful that as these trials are continuing, that we will see some data coming out in the next few months. But just like every parent, as a pediatrician, I am anxiously awaiting for when we find out when those are available to our kids.
Thank you, Dr. Suleman. We have a common question here from Anisha Virani of Coquitlam, BC.
Yali Madat, મારું નામ અનિશા છે. મારો આજનો સવાલ છે કે પહેરવા માટે શ્રેષ્ઠ માસ્ક કયો છે, યાની કે બેસ્ટ માસ્ક કયો છે અને આ માસ્ક ક્યાંથી મેળવી શકે? Thank you.
Yalimada, thank you so much for this question. The first thing to remember is that a mask should have a tight seal to your face that covers across your nose and goes under your chin. The best mask that one can wear is one that has multiple layers of filtration, like found in an N95, a KN95, or a KN94. These are also respirator masks, and they can be found in sort of a billfold or sort of that sits on a cup on your face. There are many places that you can get this mask, including online and in several stores, including hardware stores and large department stores, grocery stores. And it doesn't have to be expensive. In fact, CBC Marketplace did a test of many different masks and found that masks bought at Dollarama, which were KN95s, passed a very high test for filtration. If you're not able to find a KN95 or an N95 mask, one suggestion is to wear a surgical mask, which is a blue medical mask on your face, and make sure that you have adjusted the seal around your nose and that it's gone over your chin. For those of you that are able to get a KN95 or an N95, although these are meant to be disposable masks, you can reuse them. You must throw them out if they get wet or damaged or visibly soiled. But if not, the CDC is recommending that you can reuse them for up to 5 times. And you should make sure that you store it in a place that is dry and free from lots of germs and debris.
Dr. Nimjee, I have another couple questions for you. The first one is, if you are exhibiting flu-like symptoms, what should you do?
So the guidance and the guidelines have changed around testing. So let's start with that. So number one, if you are symptomatic at this point and you have flu-like symptoms, you have to assume that there is a very high likelihood that that is an Omicron infection. And so if you have access to rapid antigen tests or RAT testing, you can absolutely use one of those. And if it's positive, then you can trust that it's a positive result and assume that you have Omicron. We are not doing what we call PCR testing, which is what people used to go to COVID assessment centers or emergency departments to get. And that's because of a lack of availability of those tests. So now people have to, in the general public, unless they're an essential worker, would have to depend on a rapid antigen test. But those are also becoming increasingly difficult to get your hands on. So what I would say is if you have flu-like symptoms and if you don't have access to a test, you should assume that there is a very high likelihood that you have an Omicron infection, and you should follow then the guidance for somebody who has an Omicron infection. So that would mean you would want to self-isolate for 10 days from the beginning of your symptoms. Now, the isolation periods change, and so you always want to check your public health websites and make sure that the guidance still is at 10 days, but that has been the current guidance for the general public. If your symptoms worsen, of course, you definitely want to reach out to your healthcare provider to get some information. And if you are feeling much worse, namely if you're having any difficulty breathing, feeling short of breath, feeling lightheaded, you're going to want to go to your emergency department to be assessed.
Perfect. Thank you, Dr. Nimjee. You actually answered my other 2 questions, which are how reliable is the rapid test? And if you test positive in the rapid test, there is no need to then get a PCR test to confirm that result.
Yes, if I can just add, you're absolutely right. So if you have a positive rapid antigen test, you do not need to then try to confirm that with a PCR. But keep in mind that rapid antigen tests are useful primarily when you're symptomatic. They work by actually sort of breaking down some of those viral particles, the proteins, and picking them up and then giving you a positive result on a test. So if you're not shedding a lot of virus, if you're not particularly symptomatic, that test is going to come up as negative when you may in fact be positive. So if you have a positive result, that's great. You can trust it because it's picked up enough virus to tell you that you're positive. If, however, you come up with a negative test, but you have mild symptoms, I would caution you to trust that test, which is why we don't generally use rapid antigen tests in people that don't have symptoms. So I'm going to follow that up with another scenario. Let's say you have a family member who is symptomatic and has a positive rapid antigen test, and so they're isolating at home. And you decide to do a rapid antigen test even though you don't have symptoms, and it's negative. I wouldn't then say, I don't have COVID, my test is negative. I don't have to isolate along with my family member, and I'm going to go out and sort of engage in usual social behaviors. I would suggest that you don't necessarily trust that negative and that you continue to isolate along with your family member.
Our next question comes to us from Montreal.
اگر یکی از اعضای خانواده شما مثبت باشد، در روز زمان چه نوع اقدامات احتیاطی را باید ما در خانه انجام دهیم؟
So as soon as you determine that that family member is symptomatic or has had a positive test, what you want to do is exactly as the term implies. You want to try to isolate. And of course, for young children, this becomes increasingly difficult. So let's discuss that scenario second. But if the person is old enough, then they're going to stay in their own bedroom. And anytime they have to come out and be in a shared space, you're going to want to ensure that everybody is masked. If it's possible to open a window just to increase ventilation in that shared space, you should do that. You're also going to want to clean high-touch surfaces as often as you can. You want to wash your hands as often as you can, or use alcohol-based sanitizer to clean your hands. And so you shouldn't be eating together because that would obviously be an unmasked activity. So when people self-isolate within homes, usually what that means is that a loved one is bringing them a meal and leaving it at the door, and then the person who is self-isolating sort of eats alone within their room, and then for the completion of their isolation period. Now, if you have a small child that can't be separated from you, you can't self-isolate from that child. It's impossible. And so you wouldn't. When you can wear masks, certainly you should, to try to limit the likelihood of spread of infection. Keeping in mind that Omicron is so easily spread that often when there is Omicron in a household, it does spread through that household. So don't be surprised if you're doing your absolute best to try to maintain isolation, etc., but others in the home become sick.
Thank you so much. Our next question is for Dr. Suleman. Should parents feel comfortable sending their children to daycare given the current situation with COVID and given how transmissible Omicron is?
This is a question I get a lot from many families in my practice. And it's a difficult decision for parents to make sometimes because we know that daycare is really beneficial for children, for their social development, for their speech development, for their emotional development. And we also know that before COVID even existed, children in this age group will get, 7 to 10 viral illnesses a year. And we almost joke that lots of kids at this age often almost always have a runny nose at some point. And so for many families, I think it's important to think about what is going to be best for you and your situation. We know that there's lots of families who are essential workers, and so it's important that those families also get the support that they need to be able to do their work safely, and that also means having childcare available for them that their children can go to and get that enriching opportunity. And as we talked about earlier today, thinking about the other ways that you can help your child stay safe when they are at daycare. So ensuring that you and other adults in the household are fully vaccinated and getting their booster as soon as they're eligible, making sure that other children over the age of 5 are getting their COVID vaccine, getting a medical grade mask for your child over the age of 2, and keeping them home when they're sick, when they do have symptoms. Those are all ways that you can think about keeping your child and your family safe, especially when you're thinking about sending them to daycare so that they can get some of those positive developmental experiences. But I want to emphasize that the decision to send children to daycare or childcare is one that is important for families to consider for their own unique circumstances. And remember that your child's physician is there to help you make those decisions. And this is something that I often spend time talking to families about, making the decisions that are best for them and their child.
Thank you, Dr. Suleman. You touched on getting your vaccine and getting your booster shot as soon as possible. And we actually have a question from Calgary related to that.
Hi, I'm Amira from Calgary and I'm 13 years old. At my middle school, there's a lot of kids in a small space and I'm wondering when the vaccine booster will be available for kids my age.
This, again, I feel like there's a lot of questions tonight that I wish I had a magic 8 ball or something that could answer for you. So, just to summarize, right now, the booster vaccines are recommended for adults 18 and up. Right now, the booster vaccine in Canada is not recommended for children under that age. I believe we have started to see some recommendations for 16 and 17-year-olds starting to come through. And what I would advise, again, this young person who clearly I'm so impressed that they're caring about the health of their community at such a young age. That's wonderful. Ways that you can continue to help protect your community and your friends and your family. Make sure that you have gotten both doses of the vaccine that you're eligible for. Make sure you're wearing that medical grade mask, and actually help people go get their vaccines. Help like some of your younger friends and family, especially those under the age of 12, the 5 to 11-year-olds. Help them understand that it's important for them to get vaccinated. In terms of if and when we will see a booster get recommended for younger age groups, I am eager to see how that evidence comes through, and if that does become available and it is recommended by Health Canada, then I would encourage children and youth in that age group to go get their vaccine at that time. But right now, it is not recommended for children in that age group to get the booster.
Our next question comes to us from Montreal.
Est-ce que les vaccins contre la COVID sont sécuritaires pour les femmes enceintes?
Je vais répondre en français parce que je pense que c'est plus important qu'on peut parler à propos de la grossesse. Le vaccin est tellement sauf dans la grossesse pour les mamans et le bébé. And it's important to remember that when you are pregnant, you are actually at higher risk of getting severely ill from COVID-19. We are now seeing in the hospitals women who are delivering their babies and are positive for COVID-19, and their babies shortly after birth are testing positive for COVID-19. And one way to protect your baby is to get the vaccine during pregnancy. The only thing that gets passed to the baby are the antibodies. Les seules choses qui est transmis par le bébé, c'est seulement les anticorps, c'est pas toutes les autres choses. And so it's very important that pregnant women get vaccinated as soon as they are able to, not only to protect themselves from getting severely ill from COVID, mais aussi pour protéger le bébé.
Thank you, Dr. Suleman. We have another question from Edmonton.
Do you think there will be other variants, and will we likely need continued vaccines?
So viruses tend to be evolving constantly, and the general direction in which they evolve is to become more transmissible. They may even try to evade immunity, or they could even potentially become more serious. So that always remains a possibility. However, we have to take comfort in the fact that so far the vaccines that we have developed seem to have been effective against all the variants, even though we've needed booster doses with the Omicron variant. And today, it generally would take about 3 months for a new vaccine to be developed against a variant, should that particular variant be evading immunity. So we can rest reasonably comfortable in the notion that we will be able to provide defenses against other variants should they become aggressive variants. When it comes to the use of fourth doses, this is already being done in vulnerable populations where the immunity may be waning. And this is with respect to Omicron. When we were to be faced with any new variants, I guess we'll have to study the situation at that particular point in time and see what further actions are necessary. But it is my hope that with more of the world getting vaccinated and with the Omicron having spread much more rapidly, there'll be a greater proportion of the world that will be immune, as it were, and hopefully we will not get anything as bad as Omicron.
There are people who may have health issues but have been avoiding going to the doctor's office because they don't want to get sicker than they already are. Dr. Nimjee, what do you suggest somebody does in this situation?
So I think it's important, first of all, to reassure people that a lot of effort and energy has gone into keeping healthcare facilities safe. So whether that's you going to an emergency department or a hospital setting or going to a clinic setting, there is a lot of effort and energy spent in ensuring that those office spaces are not overcrowded, that there is appropriate access to personal protective equipment. So that means appropriate access to medical grade masks should you require one if you don't have one. There's access to hand sanitizer, etc., to keep you and others following the appropriate practices to keep everybody safe in that space. But I also want to add that what you don't want to do is avoid a clinical setting because you're worried about potentially picking up another infection at the risk of your chronic condition or whatever it is that you're concerned about getting worse over time. Because then you're in a situation where you're presenting sort of downstream or late in your presentation where you are sicker, right? Your symptoms have worsened. So that could be heart failure, that could be your asthma, that could be your diabetes, that could be any condition that you might live with. But when it's worse, you may require an intervention that you wouldn't have otherwise needed. It may mean that you might come to an emergency department to seek care and end up needing to be admitted, and that could have been avoided had you gone to your primary care provider or your doctor earlier. So I want to encourage people that if they're not feeling well, they should absolutely reach out to their primary care providers or their physicians. But I also do want to add that if you are looking to seek care because you have mild flu-like symptoms or cold-like symptoms, and you think you might have a COVID infection, that's where I would probably give you advice that's a little bit different. And that's where I would say that if you have access to a virtual visit with your primary care provider, for example, you could do that. But unless you're feeling incredibly concerned about your symptoms, or you are using medications like treatments for a fever that are not working for you, that's when you want to present to an emergency department. Otherwise, if you can manage your symptoms at home because they're mild, then I think it is wise to do so.
Thank you, Dr. Nimjee. Dr. Kurji, something that I keep hearing in person and online is that at some point, everyone is bound to get COVID or Omicron in particular. Should we all just let ourselves get it and get this over with?
Thank you for that particular question. I think it's a misperception that Omicron infections are always mild. Unfortunately, there are a small proportion of individuals who will actually suffer very severe consequences. And I think we all know individuals who've had COVID-19 who have had terrible symptoms, even though they may not have been hospitalized. And so it certainly is not a strategy that one would advocate. And this is why our best strategy is really to get vaccinated, to avoid getting the Omicron infections. And we must not forget the fact that, there is something called long COVID as well. And, seeking to actually get infected with Omicron does mean that we would be at risk of many severe consequences of what is often called long COVID. There are mood disorders, palpitations, headaches, various other symptoms that tend to persist, including, extreme fatigue for a long time to come. We still don't know enough about long COVID, and there may well be other symptoms as well that we would probably be susceptible to. So it is best that we avoid this in the first instance, take the appropriate precautions that we need to take on a personal level, as well as ensuring that we've got vaccinated when we're eligible.
There's been a lot of conversation about how COVID has impacted mental health. Dr. Nimjee, what kind of discussions have you been having at your provincial tables that you sit at regarding this topic?
Absolutely. So I think that what people are seeing right now, especially because of the volume, the number of people that are getting sick, is that it's exposing all kinds of weaknesses within our healthcare system. And when you speak specifically about mental health, that is absolutely an area that we've been paying close attention to, frankly, since wave one. And what we've seen is a sharp increase on the demand for mental health resources across the system, and that's both pediatric and adult systems. And so there's a lot of work being done just because the mental health system is what we call always in surge, meaning they're always at capacity and trying to create new spots, new rooms to treat patients in a hospital, as well as have adequate resources outside of the hospital for our patients. Layer onto that there's been all kinds of strain and struggle on people that have obviously impacted their mental health. And so now the actual volume, the numbers of people that require supports has increased. And so I think people are really feeling that and are really asking, what do I do? Where do I go? How do I access the supports that I need?
Thank you, Dr. Nimjee. Dr. Suleman, would you like to speak to this topic as well from a pediatric lens?
Thank you, Iman. I certainly, as a pediatrician, I believe that children and youth have borne the brunt of this pandemic. And every single time I am in clinic, I hear from families and from youth and children who are having a really difficult time. So I think it's important to acknowledge that it is hard for so many children and for so many young people. Many people have asked me what they can do right now. And so some advice for families is, number one, express your feelings, validate that this is a difficult time, that it's important to express how you're feeling and find a way to have that outlet. The other important things to do are to take care of your physical body. So make sure you're getting movement, you're eating well, you're hydrating, make sure you're getting rest, and still find a way to connect and foster connections with people. Those are all things that can help buffer our mental health during these difficult times. And lastly, especially to families who are seeing children in their families and young people having a difficult time, do not hesitate to reach out to your child's healthcare provider for help with their emotional or mental health. And certainly if you are concerned, do reach out to emergency services to provide support in that moment.
Thank you both for touching on that very important topic. I have a question now for Dr. Kurji. This pandemic has been grueling. Do you see any end in sight?
Thank you, Iman. So, many people believe that we may be reaching the peaks for the Omicron. Certainly some countries like the US and the UK, could well be at that particular point, as we have seen South Africa has already gone through that. And, some of the experts in Ontario believe that maybe by the second half of January, we might perhaps reach that peak. Now, there are many other people that believe that given the fact that Omicron seems to have had this exponential growth, in some ways it may have provided immunity to that section of the population that perhaps hadn't had immunity in the past as a result of not actually having any vaccinations at all. And I think with the high coverage that we have been having in terms of vaccination coverage, it is very possible that we may actually be starting to see the end of the pandemic in the not too distant future. However, given our experience with SARS in 2003, there will continue to be, many instances of smaller instances, smaller outbreaks or, false alarms. And I expect that to carry on for at least another 2 to 3 years. So it won't be a situation of just flipping the switch and everything coming to an end, but it will be a question of having a bit of a turbulent period, but slowly and steadily we will see the end of the pandemic.
Do any of you have any final thoughts that you would like to leave the Jamaat with before we end today's session?
Thank you, Iman. I would suggest that the Jamaat just hang in there and try to take personal responsibility, which you have actually been doing so well in the past, by ensuring physical distancing, masking, hand washing, and ensuring that you're up to date with the vaccinations. I think by following all that, we should be able to stay safe. Thank you.
My thoughts really are that I think all of us, the Jamaat, the general members of the larger community, everybody has struggled in some way through the last almost 2 years now. But I think at the same time, we've all been able to find the small silver linings, the things that keep us going, the sense of community. We're fortunate to have our Jamaat Khanas and be able to go to a place that brings us a sense of peace. And, when I have my physician hat on, I think about, especially from a systems transformation perspective, I think that amazing innovations will come out of this as well. So that's something to be hopeful for as well, because I think that the system needs to grow and needs to become more resilient, and I'm hopeful that it will. Thank you.
From my perspective as a pediatrician, again, I think to all the kids and young people out there, you have really borne so much of this pandemic on your shoulders, and we owe it to you to get boosted, to get vaccinated, to protect our communities as much as possible so that we can have a brighter future for you ahead. And don't be afraid to voice how you're feeling. You are not alone. Reach out for help, connect with one another, and we will get through this.
I want to thank our panelists, Dr. Kurji, Dr. Nimjee, and Dr. Suleman for providing their time and expertise. It's been a real privilege having you here. It's also, if I may say, a source of great pride that you and so many other healthcare professionals in the Jamaat are playing a critical role in supporting our country through this crisis. Thank you for your incredible service. I also want to remind you that if you or a member of your family or a loved one has questions about COVID or Omicron, please remember that we are here to support you. You can reach out to the Access line at 1-888-536-3599 to be put in touch with one of our healthcare supports who can guide you through whatever questions you may have. Also, a final reminder to please complete the Canadian Household Jamati survey. Only one member of each household is asked to complete the survey, which helps us to identify and respond to the needs of the Jamaat. These results are also shared with Maulana Hazar Imam to provide an overview of the progress of the Jamaat in Canada. The survey closes this weekend and can be found at iicanada.org. We end, as always, with an inspirational musical piece from our talented artists. Thank you all for joining us. Be well.
जब भी पुकारा ने गदीरे खुम में मनकुन तो फरमाया कि जिसका हूँ मैं मौला उसका है अली मौला।
है अली